Hello, I'm Anna Brook, a public health consultant and honorary research fellow working on the commercial determinants of health. This has included working with local authorities, including Derbyshire County Council, to develop and deliver CDOH Essentials, sessions like this e-learning, to improve knowledge and understanding and to begin thinking about how to apply this learning to everyday roles so that we can maximise benefits and minimise harms associated with the commercial determinants of health. A framework for local action has been developed to support local authorities, consisting of 9 dimensions. Number 1, it's important to consider strategies for tackling the leading causes of poor health, such as local health and wellbeing strategies or public health strategies, through a commercial determinants of health lens. You could start by developing something such as a commercial determinants of health angle to your existing health in all policies approach. Number 2, higher prices are a proven way to reduce consumption and can create barriers to people initiating the use of a harmful product. At a local level, some local authorities already do this in council-owned cafes and shops. Increasing the tax on tobacco has been a key factor in reducing sales and thereby smoking prevalence and health harms internationally. Local areas can help to pilot and can contribute to national debates, influencing for national level changes to pricing, which will benefit health. Number 3, local strategies can also include curbing harmful advertising through a robust advertising and sponsorship policy, particularly in public spaces. Several organisations have produced guidance for local authorities, including Ad-Free Cities and Sustain. You can also look at examples of policies from local authorities such as Sheffield. Some places have focused on encouraging local business advertising rather than multinational corporations, as well as encouraging healthier products. Number 4, there are also opportunities to reduce access through legislation and other local rules such as planning. Incorporating restrictions in local plans and planning documents can restrict the proportion and density of certain outlets, like gambling and licensed premises. Boundaries can also be set to require a minimum distance between such outlets and places like hospitals and schools. Number 5, treatment is also really important to help people with established addictions or usage to change their consumption of harmful products. As with all public health services, it's important to consider the effectiveness of treatment options available. For example, there's a really strong evidence base outlining the principles for effective smoking cessation, whereas treatment options for some other issues have a more mixed evidence base. It's also important that we consider the relative spend on treatment versus prevention. Recently, we've seen the expansion of stop smoking services at local level and the introduction of specialist regional NHS clinics for people experiencing gambling harm. Number 6, local evidence-based communication and public health messaging can improve critical health literacy on specific topics to ensure that people are alerted to harms and action that can be taken to address these harms, including policy changes. They can also motivate behaviour change and normalise having conversations around sensitive topics. It's really important in designing such communication campaigns to ensure that they retain a focus on the population level rather than just individual level. Private sector activities play a significant role in shaping our environments and ultimately influencing our choices and our behaviours. Focusing only on individual behaviour overlooks the ongoing drivers of that behaviour which we encounter throughout our lives. Focusing only on those with acute issues overlooks a significant proportion of the population who are at risk of harm and could benefit from preventative intervention. Furthermore, focusing on individuals perpetuates a personal responsibility narrative, which can be stigmatising and can also result in a narrow and less effective set of responses and solutions. The increasing burden of non-communicable diseases, despite investment in related health services, shows that individual treatment is not the sole solution. Number 7, regulating products can reduce access to harmful products, particularly for children. At a local level, trading standards can enforce existing regulations such as age of sale to ensure that it is effective. Number 8, regulating the environment is key. For instance, national smoke-free legislation covers almost all enclosed public spaces. Again, at a local level, trading and food standards teams ensure compliance with such regulation. And finally, number 9, protecting the policy-making process is integral. The Association of Directors of Public Health have published the Good Governance Toolkit, which I and my colleague Catherine Kerner developed, to help local authorities develop good governance policies to maximise benefits and minimise risk for population health. This is about supporting organisations with consistent decision-making to ensure that goals are aligned, independence and institutional integrity protected, transparency and accountability are maintained. At a local level, this might cover decisions such as who you should work with to deliver a service, ensuring that they do not have any inappropriate industry ties, who sits on a partnership that determines policy and strategy, or what kinds of sponsorship are acceptable. Some of these actions will be quicker to implement, whilst others may take time and involve multiple people working towards changing policy and process over the longer term. I hope that this short overview provides a glimpse into what you, your team, or your organisation can do to reduce the harmful effects of the negative side of commercial determinants of health, whilst beginning to think also about how you could enable the positives so that we can improve health for everybody.